morning again to you, members of the press. I wish to make a brief statement on the following. The first is the opening of the Dr. Betty Wells Urban Polyclinic for services. The second is an increase in the number of physicians who have been engaged with the Ministry of Health, Wellness and Elderly Affairs. And thirdly, an update on the Viewfort Wellness Center repairs and rehabilitation. As promised, services started at the Dr. Betty Wells Urban Polyclinic today, 16 December 2024. The services that are currently available at the Dr. Betty Wells Urban Polyclinic include the National Eye Clinic and the services at the National Eye Clinic. That specific clinic, the services started before today. But from today, the additional services include urgent care, medical clinics, diabetic and hypertensive clinics, pharmacy services, minor wound management, and home visitation. The operating hours are Monday to Sunday, including holidays, 8 a.m. to midnight. The National Eye Clinic, Monday to Friday, 8 a.m. to 4:30 p.m. I want to thank all the medical professionals, nurses, doctors, members of the administration of the Ministry of Health, Wellness and Elderly Affairs, and their support staff who worked throughout this past weekend to ensure that the finishing touches were put to the refurbished section of the Victoria Hospital to accommodate the start of services at the Dr. Betty Wells Urban Polyclinic. The rest of the Urban Polyclinic will be rehabilitated. We are working on what was called the Accident and Emergency Building. This building has been gutted, as we've reported before, and this will become another urgent care and accident and emergency unit for St. Lucia. As we all know, the Viewfort Wellness Center is under repair. The work which has been completed so far at the Viewfort Wellness Center include the removal of the central air ventilation, the installation of split and cassette units, which will serve the air conditioning needs of the building, new electrical and ceiling works, roof repairs, deep cleaning and air quality treatment. Now the contractors are checking to ensure that certain leaks which were detected earlier can be checked and repaired so that the Viewfort Health Center or the Viewfort Wellness Center can be reopened very soon within the next few days. I'm very pleased to report to you, members of the press, and also members of the public, that the Ministry of Health, Wellness and Elderly Affairs has engaged 8 new district medical officers for the Betty Wells Urban Polyclinic. There were 2 district medical officers at the Castries Wellness Center. We will now have 8 new medical professionals or doctors for the Betty Wells Urban Polyclinic. We have also engaged 2 additional senior medical officers who will be engaged with the Ministry of Health, and their roles will be 1, urgent care, and 2, a supervisor for the district medical officers. We are continuing to ensure that St. Lucians received increased high-quality medical care, and the additional medical professionals will help in that regard. This is in addition to the new service which we have added to our universal health coverage program. We have reported on it before. But I wish once again to remind St. Lucian men that we have added new services to our men's health clinic in universal health coverage. And these services will include PSA tests and other urology services, if required, at no cost to our men in St. Lucia. I wish to state that we are very pleased with the support from the Prime Minister of St. Lucia. We meet regularly every week to assess the situation with our health services, and resources continue to be pumped into the health services to ensure that we improve the situation, not only with the structures, but also with the human resources for health. I wish to congratulate the many student nurses who graduated from the Sir Arthur Lewis Community College just a few days ago. This is the first cohort of nursing students who studied at the bachelor's level, and I look forward to their services being provided to the health care system in St. Lucia. We will continue to provide support to the nurses. In addition to the stipends, we are working on a retention plan for nurses here in St. Lucia, and there are other programs we are working on, especially in regard to the training of nurses, and Prime Minister will make an announcement in that regard very soon. So these are a few announcements. I also wish to tell you that the progress on the St. Jude Hospital is moving very smoothly. We are seeing many new developments at the rehabilitated site. We are seeing the completion of many rooms and the wirings and so on. So we are very pleased with the progress in that regard. We continue to assist the hospitals with their short-term, very urgent needs. For example, at the St. Jude Hospital, we are working with the St. Jude Hospital to help them provide more human resources, especially in the emergency department. In the new year, in 2025, we look forward to the completion of the Dr. Betty Wells Urban Polyclinic. As I've said before, work has started there, and new services are being provided as we speak. Some of them started today, the 16th of December. The Groside Polyclinic will receive additional structures, and this polyclinic we are hoping to complete within 3 to 4 months so that we can have a 24-hour service. We are also working on the Dengue Hospital to ensure that we increase the number of hours there, and the Grand Riviere the Larissus Health Center will be opened in January. So there are a number of initiatives, and 2025 looks very promising for our continued progress towards healthcare reform in St. Lucia. I thank you.
Minister, just one question for me. So what happens to the Castries Health Center? Is it coming on stream? What's the latest on this?
The services at the Castries Health Center will be transferred to the Dr. Betty Wells Urban Polyclinic. In fact, a number of these services started this morning, the 16th of December. And let me explain. The Castries Health Center, as we've said before, the Castries Health Center, services at the Castries Health Center had to be discontinued because of reports from professionals, both environmental health professionals and also professionals who work at the Labor Department, professionals who look into the structural integrity of buildings. Reports have indicated, and those reports were from way before our time, reports have indicated that the building which housed the Castries Health Center is not structurally sound, and also this building, unless some major rehabilitation is done to it, should not be used to house professionals or be used to house patients or clients. We had to take a decision to discontinue services at the Castries Health Center at the current location. These services were diverted to the La Clery Health Center and the Entrepot Health Center. As of today, 16th December, a number of these services can be accessed at the Dr. Betty Wells Urban Polyclinic at the location where we called Victoria Hospital in the past. We have met with the Minibus Association, and bus services will be provided there. But we are also working, the Ministry of Health, Wellness and Elderly Affairs is working with the Prime Minister's office and with the Prime Minister. Prime Minister has donated a brand new minibus to the ministry, and this is now been, the minibus is being procured, and this minibus will be used especially to assist the elderly and others who have to access the Dr. Betty Wells Polyclinic at the Victoria Hospital site.
So does that mean that the Castries Health Center is not going to be reopened again? Is it shut down? That's what you're telling me?
The Castries Health Center will not continue services at the location it was before. Until this building, the government will decide what happens to that particular building, but all the services of the Castries Health Center will move to the Dr. Betty Wells Urban Polyclinic.
Yes, Mr. Minister, on the same Castries area, we know these residents from the urban areas, Entrepot, Marshall, they've said that there used to be a clinic at Entrepot and also at Marshall. What has become of this?
There is still a clinic at Entrepot. There is still a clinic at Entrepot. And what we're going to do is to augment that clinic over time. We are going to increase the level of supplies and human resources at Entrepot, also at the La Claire Health Center. But most of the services, in fact, all of the services, all of the Castries Health Center services will be at the Dr. Betty Wells Urban Polyclinic. And there will be more services because we are adding urgent care, and very soon we will be having emergency care at the newly refurbished emergency care center.
So will that help to ease out the congestion at La Claire? Because there was a lot of congestion.
Yes. Yes. In fact, the services that are now being provided at the Dr. Betty Wells Urban Polyclinic will help to ease the pressure at La Claire. Our officials are assessing the situation because today is the first day, and hopefully by the end of the week, we should be able to give figures to show that individuals have transferred to the Dr. Betty Wells Urban Polyclinic.
So for the record, the Castries Health Center is no longer used as a health center for St. Lucia. We do not have a Castries Health Center, for the record.
For the record, the services of the Castries Health Center will move to the Dr. Betty Wells Urban Polyclinic.
Mr. Minister, it's been reported that there have been some leaks at the waiting room of the Dr. Betty Wells Polyclinic, which we understand you're aware of. Is there a timeline by which that will be repaired or taken care of?
In fact, yes, the waiting room at the Dr. Betty Wells Urban Polyclinic is a waiting room which has been there for a while. We are going to refurbish this waiting room for now. Yes, we are aware that the waiting room requires some repair. And just today, I was informed that our technicians are going up there to assess the situation. And yes, something will be done about it. But I also wish to inform the public that the whole layout of the Sir Winston Paris Medical Complex will be changed. The security booth, the waiting area, the car park, all of this will be changed. And in the next few months, you will see a transformation of what we used to know as Victoria Hospital into the Sir Winston Paris Medical Complex. And all of these have been worked on. So when this happens, you may see a change in the waiting area. We are going to augment it. We are going to make it more comfortable. But we did not want our St. Lucians, we did not want St. Lucians to be waiting for services while we complete the whole infrastructure. So that is why for a couple of weeks now, we have started services at the National Eye Clinic, which houses the Cuban Eye Clinic and the Diabetic Retinopathy Clinic. Services have started there. And this morning, December 16th, 2024, we started services at the Dr. Betty Wells Urban Polyclinic.
Are we still testing for COVID, and mandatory masking or sanitizing back in the future?
Well, the COVID-19, testing for COVID-19 has gone into what we call the primary care setting, meaning that testing for COVID-19 is routine now. So when you go to the wellness center, you go to your doctor, if you feel flu symptoms and so on, many doctors will ask you to test for COVID, just as you may want to test for influenza and dengue and so on. So COVID-19, the COVID-19 disease or the virus is now treated as part of our primary care protocol. So masking and so on, with the doctors and the medical professionals, the ministry continues to encourage individuals to wear masks. If you feel that you have symptoms of the flu, you should wear masks. If you're going into an environment where you may be exposed to the virus, and it's not just for COVID, it's also for the common flu and the common cold and so on. So it's encouraging to see a number of St. Lucians who still wear masks. I go to the market and to the supermarket and you see a number of St. Lucians who still wear masks. So we continue to encourage St. Lucians, especially during this time, mass crowd events and so on. If you feel that maybe you have a cold or you may be transmitting viruses and so on to other individuals, to be responsible and to take the necessary precautions.
Will we be fumigating?
Well, the ministry, the Department of Environmental Health continues to assess that particular situation. We have indicated before that a number of products that were used for fumigation are being assessed for the efficiency, and that process continues. But we continue to have promotional activities throughout St. Lucia. There was one in the constituency of Vieux-Fort North not too long ago, and we continue to encourage households to do the very basic things, to check your yard and to clean up your drains and to check your guttering, and if you have drums with water, to cover them, and tires, if you have cans around the home, to look at all of these situations. We go around the country, and there are communities where people still go out on a Saturday or on a Sunday or during the week together to clean their communities. But sadly, there are a number of communities, a number of areas where individuals no longer carry out those activities. We want to encourage St. Lucians to do it, because when you do it, you are protecting yourselves, especially from dengue. And dengue can be very serious, even fatal, if you do not take the necessary precautions. So we urge St. Lucians, especially now that we're seeing intermittent showers, we encourage St. Lucians to do what is right. Clean around your homes. Start from there, and then open it up to the communities. And let's do what is necessary to protect ourselves.
The Ministry of Infrastructure revealed that from the Castries rehabilitation project, they found asbestos pipes, and there is a concern that there may be more from the city. Is the Ministry of Health aware of this, and what is being done?
Well, I know that the situation in situations like this, the Department of Environmental Health and other agencies will collaborate. I'm sure there is collaboration happening, and hopefully you will get a report in the new year. But of course, the whole issue of asbestos and other compounds that are in the environment are always of concern to us. So our ministry will continue to collaborate with the Department of Infrastructure to get to the bottom of it.
Just briefly, just to clarify, you mentioned the Winston Paris
Right.
Medical and the Betty Wells clinic. Is it one complex? Is it?
Betty Wells is
Yes. So the Winston Paris Medical Complex is the whole complex. Let's look at it as the whole Victoria Hospital. But in that complex, you have the secondary care hospital, which is operated by the Millennium Heights Medical Complex. This has been fully refurbished and been operated for over a year now. There are patients there and so on. It's been operated by the Millennium Heights Medical Complex. There's an operating theater and so on. The Dr. Betty Wells Urban Polyclinic is made up of the National Eye Clinic, the Urgent Care Center. Let us just think of it that way. All the services of the Castries Health Center are now taken into the Dr. Betty Wells Polyclinic, Urban Polyclinic.
So that is the name of the complex.
The complex is the Winston Paris Medical Complex, yes. We are going to have a formal naming ceremony as soon as all of the rehabilitation is done. I just want to say to you, members of the press, and to your family, to have a safe and a wonderful Christmas. Be safe, eat well, and exercise, do all the things that keep us healthy. And I look forward to 2025. Certainly, as the Minister for Health, Wellness, and Elderly Affairs, we have a lot in store in 2025. We are working on a number of projects, not just infrastructure, but human resources for health, a number of processes that we are redefining, reshaping processes. I really wish to thank you for highlighting the stories from the Ministry of Health's perspective, but also for highlighting the challenges. And we have done a lot of work with the Prime Minister to face those challenges, especially at the Owen King EO Hospital. The work we did at the Bodily Correctional Facility to ensure that we have a permanent a small medical facility there, and all around St. Lucia. So I really want to thank you for your work. But I cannot leave if I don't thank the people of V4 North who elected me to Parliament, and wish them a wonderful Christmas, a safe and productive Christmas, and also a prosperous and productive 2025.
Turning Point, was it just closed? Turning Point, what's the status of that?
Well, Turning Point, the Dr. Damian Greaves, who is the new Chief Executive Officer of Turning Point, did put out a statement a few days ago to indicate that Turning Point, the services at Turning Point are available, and he encouraged individuals who want to use the services at Turning Point to please contact the Millennium Heights Medical Complex for services. So the services at Turning Point have been available, they are available, and anyone who wishes to access the services at Turning Point can contact the Millennium Heights Medical Complex. Thank you very much.
Yes, thank you. Season's greetings to all of you. Well, I'm pleased to announce, and of course, those of you who are on the, driving on the road would recognize that there's an intensity in terms of the cleaning of our environment, our roads. This is a stimulus program as designed by our Prime Minister. One is to really to keep our environment, to make our environment as clean, and of course take beautification to the next level. So it's not just the mere cutting of on the roadside hubs, but also we're looking at the overhead trees that are, making it difficult for persons who are driving to have good visibility. So we are taking care of that, and there's quite a bit starting from the Mon on our main roads in the south of the island within communities. So there's quite a bit happening in terms of the stimulus activities in ensuring that at this point in time, and of course hopefully we will maintain a clean environment and have solutions to have an appreciation of the place. This is happening at this time. Of course, you would have seen recently the renderings for the juvenile center that has been promised. It shows great promise. The design the renderings is beautiful, of course, but I think the final product will even look far more interesting than what you've seen on the renderings. So we're moving in the phase of the working drawings and the tender dossiers. So hopefully we could realize the transformation or repurposing of the George Charles Secondary School into the first class, I think it would be the best in the region, of a juvenile center for rehabilitation, for engineering the mind of our young people, so that they can continue making a contribution to our society. We moving away from the stigma associated with the Boys Training Center, the transit home, Uptown Girls, in terms of how they are viewed. These programs have had tremendous success. However, the way society view it in terms of some of the failings has not been good. So a new juvenile center will actually bring all of this together in terms of these various institutions, and of course the programs would be enhanced. The persons working there would be retooled, capacity building, so that we can respond to the challenges of the times.
Critics are saying mixing girls and boys in the facility is a bad idea. What are your thoughts on that?
Well, to be honest, I do not share the idea that mixing girls and boys are a bad idea in the context of how you have an institution where young girls and young women, they would be demarcated, they would have their own space. The security purposes that you can have a facility where you have young men and young women, girls and boys, but of course with the management of them, it happens in the Bacalet Juvenile Center in Grenada. There are young boys and young girls, and they are recording tremendous success. The issue of our young men and women, what most times society are afraid of, is what happens to young men and women, whether they are in a juvenile center, whether they're at school, and what have you. We have positive feedback in some juvenile centers when young men and young women, for example, if you have a musical class, they meet at that point where they interface doing music together. The cost of having to an institution where you're providing musical for young men, and at another institution you have to repeat, you're doing cooking or some skills, but you have it separated, that is very costly for the taxpayers. So there are times when in a juvenile center, young men and women will be in the same class, but for the practical purposes of how they live, there will be separation, there will be managed, there will be controls.
We note that the SSDF is a branch or unit of the ministry. Have they been taking on added roles? We know there's the caregivers and certain roles that the SSDF putting more input into training and stuff in collaboration with the ministry of equity.
Yeah, the St. Lucia Social Development or the Poverty Reduction Fund as a vehicle towards moving our social interventions forward, our social safety nets, social protection initiatives. That has been the design of the St. Lucia Social Development Fund, and of course it's designed so it can respond quickly. Central government is not able sometimes to respond as quickly as a statutory organization can respond on certain types of programs. So the idea of the St. Lucia Social Development Fund is for the effectiveness, the speed of responding to social initiatives. Yes, over the years, we are able to design and conceptualize other social interventions, other social protection initiatives, like the Elder Care Program, Our Boys Matter program. These programs are best able to be implemented within the St. Lucia Social Development Fund, within a statutory organization, because of the flexibility that is required. And of course, we all know that our procurement rules within the public finance regulation doesn't allow for implementation of these kind of programs with the ease that you want to implement it. And yes, the design of the St. Lucia Social Development Fund, doing the institutional strengthening, the capacity building, working with other institutions to bring them up so that advocacy and they can do better at what they're doing, certainly is the design and the purpose for the St. Lucia Social Development Fund.
And this goes spread right throughout the country?
Yes, we work with institutions throughout. Institutional strengthening has been part. So agencies across the island, non-government organizations that make requests to the St. Lucia Social Development Fund for support in enhancing their ability to do what they're doing at the level of the community, of course, they would receive support from the St. Lucia Social Development Fund. Mm-hmm.
What will happen to the existing boys training center facility and transit facilities once the juvenile center is open?
Of course, these properties would be available for the other agencies of government to rethink. Of course, the Boys Training Center site is on a prime piece of land that one could value as millions of dollars. So its location has evolved into maybe touristic and other forms of. It's also next to the headquarters of the police department, and of course, one could start to look at maybe a use that's compatible with what is happening around it, as against having a juvenile center for boys in the midst of police headquarters. You have a health center, polyclinic on the other side. So the area has evolved and has transformed, and I think the land has given, certainly must be repurposed, and it now has an opportunity to look at something compatible with what's happening in the area. So I think I leave that for the Ministry of Planning and other professionals and persons who desire to, that may want to use that land for something else in the future.
Maybe I'll ask you the more controversial question. You're the Minister of Equity, and there's stimulus taking place throughout the 17 constituencies. To your mind, is the allocation or distribution of resources to support that program?
Can you repeat your program?
Is
Repeat the question,
distribution of resources related to the stimulus or STEP fairly shared?
Absolutely, absolutely. The Prime Minister is a mathematician, and he has his calculator and he believes in the principle of equity, social justice, and empowerment. I think over the years, being in his cabinet and seeing how he has lent support, it's always timely. There are times when it's a nature of crisis. The Prime Minister responds accordingly. So I have full confidence in the way that he has managed and he has provided resources across the country. Sometimes I don't pay attention to some of the areas, but when I get feedback from colleague ministers, of course, it accentuates this point. As it relates to Castries South, I can attest that we've received sufficient resources to respond to the nature of the constituency. Of course, it's a very green and wet place. We have forest here, and the hills produce a lot of, the rainfall is always there, the Badlil, and therefore it's always green. You get a lot of, the grass always growing. We do not have sidewalks, so the place tends to look that way. And of course, the Prime Minister has provided adequate resources for us to improve the look of the constituency.
But does it surprise you that maybe the Choiseul constituency or the MP seemingly isn't satisfied with the amount of resources allocated? Complaining of $50,000 being inadequate.
Yeah, of course, it's unfortunate that the Choiseul MP would say this, especially understanding the nature of what he has said in time past, how he has welcomed and supported this giving. I think it's mischief, political mischief at this time, to indicate that what you're receiving is not adequate. Certainly, the history of what has happened in government and what this Prime Minister is doing speaks volume to something completely different. So it is just mere political mischief for the member to indicate that it's not adequate.
Any other questions? No?
Thank you, sir.
Thank you. Merry Christmas.